A good history saves unnecessary investigations. A strong beginning builds trust, comfort, and better communication, the foundation of every good clinical practitioner. History taking begins with patient profile. Name, age, any age related disorders, and address for endemic disease, sex for sexual any diseases, occupation for any occupational disorders, religion for dietary habits, marital status for any sexually transmitted infections. These are in patient profile we should take. In chief complaints, write in a patient own words. So in this you we need to mention the duration and in the chronological orders of the what are the patient will tell. We need to represent in a chronological order, like if the patient is tell fever in 5 days ago, and the next day will be headache, and third day will be vomiting, and today will be some rashes is appeared. It helps in disease progression and help in the diagnosis. So what is the duration? In exact duration will be helpful in diagnosis. For how long you are ill, it will give an information about when you completely normal. If this completion for first time, you have another episode. So another one is history of present illness. So in this we need to uh, follow the Socrates rule. So what is Socrates rule? It is site, onset, character, radiating, aggravating factor, relieving factor, and duration, and also severity. So onset is sudden, it is happened, or gradually it is increasing day by day, or progression it is continuous or intermittent. So it is where is the site? It actually is, for example, any inflammation has happened. What is the site? What is the onset? When it is started? It is started suddenly or gradually. So what is the character? It is any type of symptom can be seen. It can be sharp pain, dull pain, or burning pain. It can also seen. So any radiating pain is seen, or aggravating factors. What are the aggravating factors? For example, any food or any traveling history or anything, something aggravating factor will be there. We need to collect that. And then relieving factors, what are the medications they are taking for relief, so we need to consider. And duration of the severity, and we need to take from the patient by asking some questions. So why history of present illness is important? So history of present illness help in clinical diagnosis, disease progression, and guides investigation. What are the investigation? For example, if you give an investigation for CBC test or LFT, RFT, it will for a if we did the proper history of present illness, we can guide them what are the test in this, and it is planned for a treatment also. So in history of present illness, how to write in a proper way? So listen carefully. Always relay story in days before admission. So example, you can say 1 week before the admission, the patient felt while gardening and cut his foot with a stone. So we need to narrate this in details. So by that evening, the foot became swollen and patient was unable to walk. The next day, patient attended a hospital and they gave him some oral antibiotics. He doesn't know the name of the antibiotics. So there is no effect on his body. So on the 2 days prior admission, the foot the foot is continued to swell and started to discharge the pus. There is a high fever and rigors with nausea and vomiting. It can be seen. So this type of history of present illness we need you need to go represent in a proper manner, or it can be taken as a chronological order. So I will give a tips. It is an important note also. Avoid a medical terminology and make use of descriptive language that is familiar to them. So and ask the patient for Socrates for each symptom. For example, any symptoms one by one they are telling, we need to go on asking the question like Socrates, site onset, uh, radiating or aggravating factor, relieving factor, and severity. We need to go on asking uh, that questions. So what are the next will be associated symptoms. What are the associated symptoms along with the main symptoms? So if you taken as fever, along with fever there are some associated symptoms. What are those? That is, chills can be seen, rigors can be seen, headache can be seen, vomiting can be seen, body pain can be seen. So here fever is the main symptom, and associated symptoms are, these are the associated symptoms. So cough is the main symptoms, and along with that associated symptom will be sputum, hemoptysis, chest pain, and weight loss. These are the associated symptoms with the cough. In chest pain, breathlessness, sweating, nausea, palpitation, and radiation to the left arm. These are the associated symptoms in chest pain. So for example, taken in abdominal pain, so vomiting, diarrhea, constipation, fever, or loss of appetite, these are the associated symptoms. So if the patient is unable to tell the associated symptoms, we need to ask them if any cough is there. For example, if any cough is there, we need to ask them sputum is appearing or not. If happen, what is the color of the sputum? It is what is there is any blood will be coming or not. We need to ask them in our language. So next one is past history or any surgical history we need to take. So it is main thing because listen, any MI, diverticulitis mellitus, asthma, so RHD, rheumatic heart disease, and tuberculosis, jaundice, fits, IHD, and COPD. In this case, uh, we need to mention them. So if it is there, we need to take that time, duration, and what are the medications they are taking. We need to mention that. So how, if the diabetic is present, so mention the time of diagnosis and current medication and clinic checkup which is previously done. So second one is past surgical history. So in past surgical history, time should be, place, and what type of operation is done. So note any blood transfusion, blood grouping will be done, and we need to ask this question also. It is going to be the important one. And history of dental extraction or circumcision, or history of any trauma. These are the important things in history taking. So